Hello everyone, my name is Imani Mitchell, and the title of my presentation is Does Timing of Exposure Matter? Maternal Depressive Symptoms in Early and Middle Childhood and Academic Outcomes in Adolescence. I want to first start off by stating the problem and my reason for engaging in this research. We as scholars know that major depressive disorder is one of the most common chronic mental health disorders. According to the National Institute of Mental Health, 19.4 million adults in the United States had at least one major depressive episode in 2019. Now, the prevalence of depression is higher for women than it is for men. This is especially important because research shows that maternal depression may have a spillover effect and negatively impact children. Additionally, research has begun to investigate the association between maternal depressive symptoms and academic outcomes among children. However, we see that minority youth are often understudied. Given the existing education and opportunity gap that exists between minority youth and their peers, I wanted to focus my research and efforts on filling this gap. The goal of the current study is to examine the relationship between the timing of exposure to maternal depressive symptoms and academic outcomes for African American and Hispanic youth. My analysis is framed in the life course theory, which emphasizes the influence of earlier experiences on later life within the societal context. I aimed to determine whether exposure to maternal depressive symptoms during early or middle childhood was more impactful on academic outcomes in adolescence, and to see if this association differed by race or ethnicity. The data for the current study came from the Fragile Families and Child Wellbeing Study. This is a national study that utilized a longitudinal sample of nearly 5,000 children born between 1998 and 2000 across 20 large U.S. cities. The Fragile Families and Child Wellbeing Study consists of interviews with mothers, fathers, focal children, and primary caregivers at birth, year 1, 3, 5, 9, and year 15. For the current study, the sample was limited to only African American and Hispanic families. I also utilized data from birth, year 3, 9, and year 15. Multivariate linear regression techniques were used to assess the relationship between the timing of exposure to maternal depressive symptoms and academic outcomes for African American and Hispanic youth. To measure academic outcomes, two measures were used. One was academic achievement, and the other was academic performance. To measure academic achievement, grades in the four core subjects, English, math, science, and social studies, were averaged together, and a higher score on this measure indicates lower grades in the four core subjects. The second academic outcome measure, academic performance, assessed trouble at school using four statements: trouble paying attention in school, trouble getting along with teachers, trouble getting homework done, and trouble getting along with other students. Higher scores on this measure indicated poorer academic performance. To measure maternal depressive symptoms, the Composite International Diagnostic Interview short form was used. The respondents were asked two initial questions on this measure to assess dissatisfaction with life and a lack of pleasure. If the respondent answered yes to either of these questions, they were then asked a series of follow-up questions to assess frequency, duration, and severity of their symptoms. If the respondent answered no to both questions, they were then screened out of this measure. The current study also controlled for child sex, maternal poverty status, maternal education, maternal marital status, and the mother's place of origin. The results of the current study suggest that maternal depressive symptoms at year 3 were related to lower academic performance for both African American and Hispanic youth. This finding is consistent with the current literature that suggests earlier exposure to adverse events to be more impactful on later child outcomes. This finding is also consistent with literature that has established an association between maternal depressive symptoms and externalizing behavior among youth. Maternal depressive symptoms at year 9 had no impact on academic outcomes for either African American or Hispanic youth, and this further emphasizes the importance of the timing of the experience or adverse exposure. Lastly, there was no significant interaction between race and maternal depressive symptoms. This suggests that the association between maternal depressive symptoms and academic outcomes has the same impact on both African American and Hispanic youth. In conclusion, the findings of the current study suggest that exposure to maternal depressive symptoms earlier in life are more impactful on child outcomes. These findings have important implications for future research and policies. Future research should focus on centering minority voices rather than comparing minority youth to their white peers. By moving away from a deficit model, researchers are able to begin to identify factors that have stifled educational progress among minority students and have contributed to the existing education gap. There's also a need for culturally competent classrooms and educators. Future policies should focus on professional development opportunities for teachers to learn how best to support minority students. Lastly, access to early childhood education and maternal mental health supports for diverse communities can alleviate some of the stress associated with parenting and potentially buffer the negative effects of maternal depressive symptoms.